Hi, I'm Fabioke. You're watching the stream. Today, we're going to be looking at coronavirus and children and why the disease seems to impact children in a different way from the way that it impacts adults. We will be unpacking what we know about COVID 19 and kids. Earlier, I spoke to Temi and Tunde. They're my 6 and 7-year-old nephews in London, and I asked them, what would you like to ask our expert panel? Let's have a listen.
When are we able to play with our friends again?
I think
that's a question lots of kids are going to want to know.
That's a question that big kids will want to know, like big adults would want to know. I want to know when I can play with my friends again.
Well, little kids will definitely want it as well, especially me.
I am sure you have questions as well. If you're watching on YouTube, jump into the chat and you too can be part of today's conversation. I am going to say hello to the guests. The guests will say hello to you. Dr. Fahim, it is great to have you back on the stream. Introduce yourselves to our international audience.
My pleasure, Femi. Thank you for having me. My name is Dr. Yunus. I'm an infectious disease physician for the past 20 years, working on the COVID front lines.
Good to have you. Dr. Angela, lovely to see you. Tell everybody who you are.
Thanks for having me here today, Femi. I'm Angela Rasmussen. I am a virologist at Columbia University. I study the host response to viral diseases, including SARS coronavirus 2 or COVID-19. And today I'm here to talk about virology and susceptibility.
Great to have your expertise in our conversation. And Dr. Naran, welcome back to the stream. Remind everybody who you are.
Thanks for having me, Femi. I'm a general pediatrician in a small town in Washington State for the last 20 years. And obviously I'm seeing kids that either have disease or whose parents have disease. And so I think that's more what I'm here to talk about. Plus probably answer your niece and nephew's questions.
They have many questions. All right, let's start with William, though. William is on Twitter, and this is an entire show, a question that he asked. And I'm going to start with you, Dr. Naran. Among all of the COVID-19 cases all around the world, it seems like children are immune to the disease. Why? And what makes them so different that they can get a common flu, but no sign of the COVID-19 virus? What have you seen with the kids that you've been treating, Dr. Naran?
Well, I will say they are getting sick and they are getting symptoms. The hard part is they're not testing positive. So you assume when two parents test positive for COVID-19 that if I have a family, for example, with 8 children, and even though all 8 children don't have symptoms, it's assumed when one of them's 103, has 103-degree fever, that they most likely have disease. And again, we just can't get the testing to be maybe as accurate as we'd hoped. So in a nutshell, kids are getting it. But I think what is probably happening is they're not getting as sick, up to about 10 to 15% are asymptomatic. And the question is whether or not they're spreading the disease. And in reality, I don't really think they're as likely to spread it as the adults. And we think that either there's something different about the fact they've been exposed to coronaviruses recently, and so they have some cross immunity, or there's something different about those specific receptors. You're going to hear a lot about ACE2 receptors, which is the receptor that the virus gets in and then makes copies and sends copies out into the body of the virus. And there's got to be something different about their receptors potentially that is not making them immune, but making them maybe protected from getting as many complications.
Dr. Fahim, there are lots of ideas out there. What one are you settling on? You're an infectious disease specialist, so kids and COVID-19, they're not seem to be as sick as adults. Why?
Number one, nobody is immune. I think that we need to be very clear about, because that's a very dangerous idea. This is a novel virus. Everybody is susceptible, whether you're 1 day old or 100 years old. The outcomes could be very different because everyone is susceptible. So I think there's a lot of confusion, but still there is a lot that we have understood and discovered about this virus in the past 6 months. We know that this virus is primarily respiratory. We understand that some of these symptoms can be GI and other body systems. We also know that about 80 to 85% of the patients will heal by themselves at home. So that statistic has been validated over and over again in Wuhan, in Italy, in New York. We know that about 5 to 8% of the people will end up in a hospital, and nobody really knows the mortality, but there is a broad consensus now that it's going to fall somewhere around 1%. We also know that the vaccine is on the horizon. So I think there's a lot of good news. The topic we are discussing today, unfortunately, we don't know a whole lot about with kids. This is where there are a lot of questions. But once
Yeah.
again, I must say, good stuff is less than 5% of children are getting hospitalized. To give you some data points, 22% of US population is under the age of 18. But if you go and ask any large hospital today, about 4, 5, 7% of all their COVID admissions are under the age of 18. So we know that they're not getting as sick. We know that the death rate so far, again, it's all evolving, it's changing, but it's lower. We know that the asymptomatic rate is higher. So I look at them as the beautiful, innocent population they are. I think we adults have to get our act together and kids will be fine.
Yeah.
I'm going to put this to you, Angela, and this is from Liz Zen, who is watching right now on YouTube. Liz asks, is it true that children are at a low risk of turning into severe cases of COVID? Would it make sense to prioritize adults for the vaccine when it comes out?
That's an excellent question. It kind of gets right at what we were just talking about, in that children do appear to be less susceptible to severe disease. Adults are much more at risk of coming down with severe disease, and we don't know why that is. It may be that children have a different pattern of the receptors, the ACE2 receptors that Dr. Naran mentioned. It may be that children are responding to infection differently. So one thing we know in adults is that the severe disease is associated with out of control inflammation, something we call a cytokine storm, which means basically that the body is responding to the virus in an exaggerated and uncontrolled fashion, and that response itself is what's harmful. Children are not as likely to have that type of response. So it does make sense that we might prioritize higher risk individuals, such as adults, for a vaccine when it comes out. But that's not to say that children should not be prioritized, because some children do become very sick. It's more rare. However, children are not completely immune to this virus. They are susceptible to contracting the virus as well as to developing severe disease from it. So we do need to be careful once a vaccine is available, how it is rolled out. But it may make sense to prioritize adults in households before children to stop the spread and protect the people who are most at risk.
Dr. Naran, I'm just wondering, would you even give a child a vaccine in the early days? Would there be a risk associated with that? I'm just wondering how many of the trials have kids in them even.
So far, I haven't seen any trials that have kids in them. I don't think we, in general, with research, we don't start out with children. And, it's an interesting question because to compare it to the flu for a second, the flu vaccination decreases mortality in children from the flu. So there's a really good reason to give it. Even if it's not the most effective vaccine at preventing disease, it's really effective at reducing child mortality or death from the flu. And in a disease where we don't have a lot of high mortality rate, as the other doctors on here are talking about, where we have a really much lower risk of severe disease, to be honest with you, I think we should be cautious. Obviously, I don't have the answers to this exactly, but I certainly would be reticent to lead with vaccinating children only because their mortality rate is much lower than the older population, who's really at risk.
Dr. Yunus, I want to put this one to you, this question from Arsian Bashir on YouTube. Arsian asks, how does the coronavirus affect malnourished children in the developing world? Because children all over the world are susceptible, as you said, no one is immune. So if you maybe are not getting all of the nutrients you should, if perhaps you come from a part of the world where even basic facilities are quite hard, basic infrastructure, have you seen any or read any details about how that may well affect kids?
Yeah, I think if we broaden the question a little bit and include all the vulnerable populations, whether they're refugees, homeless, children, malnourished, of course they're going to be at a much higher risk. We don't have specific studies looking at it, but we have enough data that this is like a comorbidity. I was earlier thinking the children are going to likely to do well because they have less risk of diabetes, cancer, heart disease, all other comorbidities. But to me, malnourishment is going to be a comorbidity. And yes, you will see a little bit or
Good point.
maybe a lot of higher risk. The problem, once
Mm-hmm.
again, is going to be, are those kids going to have access to testing and hospitalization and all the other support systems? So that worries me.
Let me share this headline with you guests and audience as well. Rare multisystem inflammatory syndrome in children linked to coronavirus. We saw this headline a little while ago and everybody was shocked because up until that point, we were told, well, it doesn't really impact children that much and they seem to be quite resilient and we've heard lots about children and not about them being impacted by COVID-19. Angela, what more can you tell us about this?
So this is really what I was. Oh, yeah. So this is really what I was just speaking about. Is that oftentimes severe disease is associated with these out of control immune and inflammatory responses, and we don't understand the basis of this at all. But some children do appear to be susceptible to experiencing this type of response to being infected. So we don't really know what makes one child more likely than another to develop that type of rare multi-system inflammatory situation, like a Kawasaki disease-like state. But that is something that we are going to have to look into more carefully so that we can better identify and potentially preemptively treat children who are at risk of developing that condition.
Dr. Naran, I'm just wondering about... Go ahead. I was wondering about what the children that you are treating look like. What are the symptoms that they are presenting?
So I was, just to piggyback a little bit on Dr. Angela's answer too, pediatricians are well trained to look for Kawasaki's disease. I always say I've never let the sun set on 5 days of a fever higher than 101 without working up Kawasaki's, because it's always in the back of our mind as a possible complication of illness. And so the good news is, at least for families that are listening out there, most board certified pediatricians across the country are already aware of MISC, which is the multi-system inflammatory disease, and watching for it. And then we're well used to watching for signs of Kawasaki's disease anyway. And I know they're different entities, but it's something that we're familiar with and we're keeping a close eye on. And so anyway, just to piggyback that. And then what was your question?
Just wondering what the kids look like who you've been treating for COVID-19.
Right. So, well, there's not really any treatment per se other than reassurance. But in a nutshell, they look similar to the adults in that I'm seeing fevers. I'm seeing some of the older teenagers more are reporting shortness of breath. The younger kids really aren't. They have runny nose, cough, fever, some GI symptoms. But as you get closer to adulthood, say from 15 to 18, the kids that I've seen that I'm pretty convinced do have disease and have significant exposure history, those kids are short of breath, fevers, and cough. And they don't look well. They look like they don't feel well. And then obviously there are some that are asymptomatic. But again, that's kind of not necessarily the norm.
I want to go back to Temi, who's 7 years old, and he hasn't been to school for a couple of months now. He's in London, and obviously they had lockdown measures. And Temi was really concerned about schooling, and he had a couple of ideas. So let's go back to Temi and have a listen to his thoughts about school.
When are they planning to open school, and why? And even and also that why are they even planning to open school? Because it would be much easier to just homeschool people instead of using all their energy on making plans.
This is a big question, not just in the UK, all over the world. When do we send the kids back? Dr. Niran, you start, then Dr. Angela, you pick up.
This is probably, honestly, the most important question right now, at least as a pediatrician in my mind. It's something that I spent a lot of time thinking about and think is critically important for the youth in America. The American Academy of Pediatrics 2 days ago came out with a statement that we absolutely must prioritize getting children physically back in school. And I completely agree with them. I think children are losing out on interaction with each other, social time. They're missing out on academics, going back into being taught by people who have been trained to teach them. I've done my best, but I'm not a teacher. And so I highly respect that profession and we need their help. So in a nutshell, I think we need to head back to school. And I think what we need to concentrate on is the fact that we need to minimize adult to adult interaction. That's probably the most important part. So minimizing staff meetings, minimizing staff interaction where we can, minimizing or staggering drop off and pickup times for children. So their parents aren't standing with each other, waiting for kids and talking and spreading disease and coughing on each other, and maybe go back to some traditional schooling. So what's called cohorting children in the classroom, meaning if this first grade classroom, they eat lunch in their classroom, they have schooling in their classroom, their desks should be roughly 3 to 6 feet apart. The American Academy is more concentrating on what's practical. So maybe that 6 feet barrier isn't practical. Obviously, where it's appropriate, universal face coverings or face shields, depending on children and their disabilities, if they need to see faces or read lips. And so really, working with some common sense solutions. And that way, if one classroom's infected, that classroom is going to be interacting with each other. Yes, that's not ideal, but then they won't necessarily spread it to the entire school. So cutting out assemblies, maybe having kids take recess so according to their group, meaning the first grade gets out, then they go in, then the second grade, you know what I mean? Sort of taking each classroom and having them on their own schedule to avoid interaction with other classrooms. And it's not perfect. But again, I really, based on what I'm seeing on the ground, it's adults. It's adults between the ages of 19 and 50 that are spreading disease more than anyone else. And we're seeing those numbers go up, even double in some places since Memorial Day. And I think children are far less likely to spread disease. And the reason I say that is I've been testing children's noses for years for various diseases, RSV, flu, et cetera. I've never had problems getting positive tests. I really haven't had a positive test yet. And I know these kids have disease. So if they don't have it growing in their nose and they sneeze, I think that sneeze is less dangerous than an adult sneezing.
Dr. Niren, you have such a glamorous job testing children's noses. I'm almost jealous. Dr. Angela, you're a virologist. And you are studying COVID-19. Should schools be opening with kids?
So I think this is a really difficult question to answer because I completely agree with Dr. Niren's assessment that we do need to get kids back in school. We need to be able to safely open our entire communities, actually. It's not just schools. We need to be able to figure out how to move forward, reopening businesses, making it safe for people to resume their normal lives. One thing, though, that's not clear to me is actually the risk for spreading between children specifically. So there are a lot of conflicting data about this. A study last week suggested that children are not able to spread, or they are half as susceptible as adults to contracting the disease, which suggests that perhaps children may have the opportunity to interact with each other more. However, there's also data suggesting that children do have comparable ranges of viral loads, meaning the amount of virus that is detectable in their noses compared to other categories of adults. So including the highest risk adults, ages 80 plus. So there's really a lot of data that we still need to gather about how capable children are of both contracting this virus as well as spreading it to other people in their households. And my thoughts in general about schools is that they really they are not a bubble. They are not separate from the rest of society. So we really need to think about ways to reopen our entire communities and not just our schools, making it safe for both children and adults to be going back to business and interacting with each other in a safe and as low risk as possible way.
I want to bring in one more thought before I go back to Dr. Fahim. So this is Dr. Poonam Krishnan. She is a GP in the National Health Service in the United Kingdom. She brings up something that we haven't talked about yet. Let's have a listen.
Yes, far fewer children have been impacted from the serious complications of coronavirus in comparison to adults. However, moving forward, the biggest crisis that I fear that we're going to face is that on children's social and mental well-being. They've been taken out for prolonged periods of time from school, away from their friends, from extended members of family, and potentially been living in very stressful environments at home. And this is going to take a long time for the impact of this to unfold. So really the governments, charities need to work together to provide more support for children when they get back to school, but also we need increased funding to be able to support the mental health services that are going to be looking after the aftermath that all of this will bring.
Dr. Eunice, as an infectious disease specialist, I'm just wondering, have you ever seen anything quite like this, where we've asked our kids to stay away from each other, stay away from school for such a long period of time? What wisdom can you give to parents, to teachers, to families who are looking after children who are missing their friends?
Sure. First of all, let me make a statement that we doctors rarely make, that I agree completely with what Dr. Angela and Dr. Nuran were saying. I think we are all three in agreement about this being a very fluid, very difficult situation.
Yeah.
At the same time, this is a group that cannot always advocate for themselves. So I think we have to ethically be really much more sensitive about making sure we're making the right decision for all our children. In terms of their mental health, I agree once again that children don't live in a bubble. First of all, we need to first make sure what our children know. Have conversations at home, listen to them. Video games are one thing, but parenting is a little bit more than that. And every time I've had a conversation with my little ones, I've been surprised. They knew more than what I expected. Number one. Number two, once you listen to them, let's just be very careful not to insert our biases into them. Let's accept, we are a very polarized society right now. We can't even agree on science. And I think it'll be a real disservice if we started infiltrating our children with those ideas. We have to make sure that they respect science, that we keep our own biases out of that. Number three, add some perspective, give them good information. I think there's a lot of silver lining here. I'll just give you one data point. The multisystem inflammatory disease, the first patient who died with that disease was in Baltimore, where I practice, 15-year-old in mid-May. And at that time, we had 80,000 US deaths. So understand, 80,000 deaths, and we had the first kid dying at that stage. So there's a lot of silver lining. And I don't like the comparison with flu, but still, influenza has killed about 150 to 200 children every year. So based on what we know so far, this may change. So far, things are looking pretty good. And what we need to then do is create some healthy atmosphere for our children. So we should prevent that mental health. One more point I'd like to make is immunizations, routine immunizations. Let's make sure that we do not lose sight of measles, mumps, rubella, because if you look at West Africa during Ebola outbreaks, the measles death rate or the number of measles cases go up because parents tend to miss routine vaccination. So there is a lot of good work that we can do. We should focus on what we can do and spend less time on the unknowns, where even we doctors just give some time for science to catch up.
Question here. Ryan is a teacher. So Ryan has been watching and listening to you very carefully. My school is trying to do distance learning, but not all students can do it due to the lack of tools like laptops, cell phones, etc. The digital divide is also widening the loss of jobs. And another question, thought from Rayla, Ryan, and that is about we should be careful and cautious about sending kids back to school before there's a vaccine and before that there is widespread treatment. Angela's the virologist in the conversation. What are your thoughts here?
I mean, I think that's definitely something to consider, given that that children, again, are not going to school and existing in some bubble where they're separated from their families and other people in their households. So even though children themselves might not be at high risk, teachers, staff at the school, and people within their families are potentially at high risk. And sending them in without any type of countermeasures or intervention for somebody who may end up developing severe disease, whether that be a child or more likely somebody in their home. And this is especially pertinent for people who are living in multi-generational households where there may be grandparents or people who need full-time care in their homes and would be at a very high risk of a severe, complicated, severe COVID disease if they were exposed to it from a child. So if there's no vaccine, no therapy available to treat those people or protect those people, it is a significant risk to send children back to school, even though they themselves might not be the ones who are at the highest risk.
I wish we had another half an hour because I have so many questions on YouTube for you about children and spreading and asymptomatic. But YouTube, that's as much time as we have. Thank you for your questions. Really appreciate you. Dr. Eunice, Dr. Rasmussen, and Dr. Al-Agba, we really appreciate you being on the show today. Thanks for your wisdom and sharing the knowledge you do know about COVID-19 and children. Thanks for watching, everybody. See you next time on the stream.